All right, we'll go ahead and get started. I know folks are still joining, but I want to make sure we give as much time to our wonderful presenters today as possible. Thank you all for joining us for the final Centering Servingness webinar of the year. I'm Judy Marquez Quillama, Associate Vice Provost for Faculty Development within Faculty Affairs. And on behalf of Faculty Affairs and HSI initiatives at the University of Arizona, we welcome you. And before we move into today's webinar, knowing that it's our last one of the year, I want to make sure that we extend our thanks and my sincere gratitude to Monique Beltran, who is on. Hopefully, Monique, actually, I'm going to have you say a quick hello so they can know who you are, since usually you're hiding behind the scenes.
Yes, hello. I am so honored to support Centering Servingness. It's such a wonderful program, and I look forward to it every single month. So thank you, Judy, for the opportunity.
Thank you, Monique. For those of you who have worked with Monique before, you know that nothing happens within HSI initiatives without her. And so we're just so grateful for everything that she does to support the program. We began today's webinar by respectfully acknowledging the University of Arizona is on the land and territories of Indigenous peoples. Today, Arizona is home to 22 federally recognized tribes, with Tucson being home to the Orem and the Yaqui. Committed to diversity and inclusion, the university strives to build sustainable relationships with sovereign Native nations and Indigenous communities through education offerings, partnerships, and community service. Dr. Gina Garcia's conceptualizing of the term servingness informs our webinar series. Servingness helps us to understand and highlight the faculty and staff who engage in scholarship and servingness efforts that honor the cultures and the lived experiences of Latino, Latina, Latinx, Black, Indigenous, and underrepresented students and communities. And as I've shared before, the goals of our series are threefold: to spotlight current scholarship, offering examples of the rich ways in which servingness is enacted by faculty and staff across the institution; to learn together about engaging in these efforts; and to build knowledge, addressing the question each month, what next steps are needed to build institutional capacity around HSI servingness. As we go through today's webinar, we'll share links in the chat with you from past webinars, a little bit more about our HSI seed grants, and other programs and resources for you. Today's webinar features one of the research teams who were awarded an HSI seed grant for this year. The seed grant program is a collaboration between Research, Innovation, and Impact, or RII, Faculty Affairs, and HSI initiatives. The goal of the funding program is to support scholarly research and creative work among faculty, which enriches the U of A's designation as a Hispanic serving institution, advances scholarship that directly impacts queer, trans, and BIPOC, Black, Indigenous, and people of color populations, and fulfills the U of A's purpose and values. Today, we highlight one of these projects, Salud Sin Fronteras. The project is led by Dr. Adriana Maldonado, a postdoctoral research associate in the Department of Health Promotion Sciences within the Mel and Enid Zuckerman College of Public Health. Her research focuses on the intersection of health equity and Latino health, and her recent work utilizes a mixed methods approach to understand the impacts of social and environmental contexts on Latinos' hypertension-related disparities. Her areas of focus include psychosocial determinants of health, health disparities, mental health, and chronic diseases. Also on the team, we have Dr. Rebecca Crocker, a research associate in the Southwest Center within the College of Social and Behavioral Sciences. She's an applied anthropologist, folklorist, and engaged community advocate. Dr. Crocker takes a multidisciplinary and action-oriented approach to researching the nuances of Mexican migration, including emotional stressors, binational family separations, traditional disease, etiologies, and healing modalities, and death and disappearance at the border. Her work has been published as public reports in Anthropology and public health journals and has been cited in the Washington Post and Arizona Public Media. Dr. David Garcia is an associate professor of public health, also in the Mel and Enid Zuckerman College of Public Health. He has extensive experience in short-term and long-term intervention trials in the areas of physical activity, diet, and weight management. His current research focuses on the development of gender and culturally sensitive weight loss interventions for Hispanic males. The long-term vision of his research is to implement and evaluate large multi-site trials to systematically influence community environments and eventually policies in order to improve health among underserved populations. And finally, Dr. Daniel Dan Martinez is a distinguished scholar and associate professor in the School of Sociology within the College of Social and Behavioral Sciences. He also serves as co-director of the Binational Migration Institute in the Department of Mexican American Studies. Dr. Martinez's research and teaching interests include race and ethnicity, undocumented immigration, and criminology. He has conducted extensive research on deportations and undocumented border crosser deaths along the US-Mexico border. His current research focuses on Latinx pan-ethnicity, the relationship between so-called quote-unquote sanctuary policies and public safety, and the ecological correlates of officer-involved shootings and violent crime. Please help me welcome today's webinar presenters, and I'll turn it over first to Dr. Rebecca Crocker.
Thank you so much, Dr. Kiyama, for those introductions and for supporting the work that you all are going to hear about today. And just wanted to say how honored we are to be here sharing our research with you all today. The most of our presentation is going to be revolved around the student experiences in the SSF team, but I'm going to speak very briefly at the beginning about some of the intellectual underpinnings of this project. Go ahead, next slide, Adriana. So SSF was, some of the ideas for this project came from my dissertation research, and I did my research here at the University of Arizona, and I'm a cultural anthropologist. And what I was primarily interested in is the role that emotional stress and trauma during the migration process from Mexico to the United States, particularly to Southern Arizona, might play in explaining some of the health paradoxes and declines in health post-migration. So my primary research questions were really around the lived experience of migration in terms of the emotional impacts, as well as the ways in which immigrants understood that emotion to impact their own health. Go ahead, next slide. So one of the primary lenses that I used during my research was a life course approach. And this is an approach that's used in many fields, from nursing to psychology and a lot of other health related fields. And it really looks at the intersection of the change in time. So looking at the whole life course of somebody's life, in addition to the context and during those changes of time. So what have they lived through? Have they moved countries? Have they had access to healthcare? Have they lived through stressors or traumas that might influence their health? Next slide. So a life course approach can be very helpful for the study of any kind of health amongst all populations, but I think that it's particularly important for studying immigrant health. And there are a few reasons for that. We often, as researchers based in the United States, and most of the researchers looking at immigrant health are based in the United States, we can often lack a binational context that fully acknowledges the role of displacement, in addition to prior experiences and knowledge that immigrants may have had before they arrived. The baseline for most health studies it gets used as when people arrive to the United States. So there's a lot that's missing from that data set. We often lack statistical data, whether it's national census data or other medical studies, as well as individual medical records for people in this population. And then lastly, there are a lot of paradoxes and really important disparities, from liver disease to diabetes to some cancers, obesities, and others, that we really don't understand what's happening here. So there are a lot of gaps to be filled in. Go ahead, next slide. So for my own research, as an anthropologist, I used ethnographic research methods, which meant I was really on the ground here in Tucson. I interviewed with service providers in legal and medical and social service fields. I did weekly engagement at 3 different sites. They were a church outreach center, a health clinic, and a day laborers center. I conducted significant participant observation at many forums and venues around the city. And I also did life history interviews, and that's really the core of what this research was based on, with 40 immigrants from Mexico, first generation. Next slide. The sample demographics of this study are quite different from the demographics that Dr. Maldonado will present next. So it's interesting to note this was just a sample of 40 people. I had evenly divided it between men and women. The very low household income of just $1,400, very split between urban and rural, and it was a very heavily undocumented population at 70%. Next slide. So the results from this research, the first three were primarily revolved around my initial research questions related to emotional stress. So looking at documenting how the incidence of stress, what were the causes of those stress, looking at loneliness in a bicultural context, and looking particularly at the way in which immigrants were able to communicate and translate how those stressors actually were embodied, where they felt them in their body, how they related them to their own health outcomes, and in many cases, health declines. The last two, however, were what I would call a little bit more unexpected, although not entirely surprising data. And that revolved around two primary issues. I asked a lot of questions around how people understood their own health and what their healthcare experiences had been. One of the things that relatively screamed to me from this data was that there were a lot more barriers to healthcare pre-migration than I had been anticipating. We talk a lot about the barriers once in the United States, but that wasn't something that I had seen a lot of data on. The second piece was that the level of practices of traditional care were so high, as well as the knowledge surrounding that, and that really translated post-migration as well. So those were two pieces that really jumped out at me, and those were the pieces that feed into the project we're going to talk to you about today with Salud Sin Fronteras. Next slide. So I'm just going to briefly go through the findings that are relevant to Salud Sin Fronteras. So the first was that the lack of insurance rate, looking at the barriers to healthcare access while still in Mexico. We saw really high rates of no insurance, 60%, and most had lapses in coverage amongst those who did have insurance. There were very high costs both for paying for medical services as well as for prescription medications. Because this was half of a rural sample, there were really significant transportation barriers. Some people were days away, if not hours away from medical care. And for those who did have medical care close at hand, a lot of it was very basic services and emergency services, but most people had very little access to mental health or other specialists. Next slide. A second and very related finding, of course, was that utilization of care pre-migration was very low. So care was primarily used to deal with emergencies, to deal with acute traumas and very advanced conditions. Diagnoses were made very late in the game, and the vast majority of the sample participants had not sought or received preventive services. One interesting thing was that in this sample, there were 20% of the 40 people had lost a sibling in infancy. So this was an extremely high for Mexico at that time. So it indicates a lot of deprivation in this sample. Next slide. An additional finding was that traditional medicine usage was very high. It was 75% of the sample used it as their first recourse when they were ill. The knowledge base amongst men and women was incredibly rich, and it was also very diverse, both in the different ingredients that people used as medicine, as well as the types of illnesses and systems within the body that people aimed to cure with these remedies. An additional finding, so now moving to the post-migration findings, the barriers to care were enormous, as we know. Some of them were a continuation of barriers that had been seen in Mexico. So the uninsured rate went from 60 up to 85. Many people noted being very heavily in medical debt and not being able to afford services that they would have wanted to receive. And there remained challenges in navigating transport, and particularly the schedules of the clinics that they felt that they had access to. There were also an addition of new barriers in the United States that had not been present in Mexico. So primarily fear of detention and deportation, which, as we know, particularly in Arizona, has been very harsh, in addition to language and cultural barriers, and issues like the public charge legislation, which made people worried about the potential implications for themselves and their family if they sought care, that they may not be able to regularize their status down the line. Next slide. An additional, so again, related to this, very low usage of care while in the US. So the sample that I interacted with primarily used the University of Arizona mobile clinics, as well as a small handful of pop-up and free clinics that we have here in Tucson, in addition to emergency departments. Those who could sometimes return to Mexico for care, and we saw a really heavy reliance on traditional remedies post-migration as well. And this is interesting because there was a very high rates of chronic disease, as well as biomedical and traditional etiological mental health issues, including susto and nervios, were very high in the sample. Next slide. So, the conclusion from these themes in the study was that, as we know, there's a very demonstrated link between early life health experiences and adult health seeking practices and concepts. So within the context of the sample that I worked with here in Tucson, I really came to see that the pre-migration barriers to health care access and utilization were a lot more significant than gets documented. It's not something that gets studied very often at all, as I mentioned earlier. A lack of care has largely been normalized by people who don't have access to care early in life. So there can be a tendency to wait until things are in crisis mode to access care. The reliance on traditional medicine is very high and continued, which has a lot of positive benefits as well. And there's a lot of hesitancy around medications and mental health care, and that people were largely accustomed to trying to take care of things themselves and felt that that was probably what they were going to continue doing. Next slide. So before we move on to hearing more about the team, I just wanted to speak briefly about how we transitioned from these qualitative results to the quantitative survey that serves as the basis for the Salud Sin Fronteras research. So I was very interested to see how these qualitative results, that again, it's a small research sample of 40 people, might map on to quantitative findings amongst a larger population who were recruited in different ways. I was interested to produce more generalizable results that would be both easier to communicate and more relevant to a public health audience. One of the advantages of anthropology is the ability to get into the nitty-gritty, to really dig out the context, to add a lot of nuance, to try to help understand what we see. But our findings tend to be pretty limited in terms of numbers, and it can be hard to communicate those results to practitioners and to a public health audience who's really going to be able to apply them. That was something that I always really cared about. But one of the other reasons why I wanted to create a team to come together around this was because I felt that it was very important to engage with students and faculty who had lived experiences of migration. Because this lends new perspectives, obviously really informs it. It changes the goals for how we do the research, how we disseminate the research, and offers an ease of connecting with participants. And I had the experience that when I spoke to people about this research, people who had immigrant experiences either in their own lives or their families, that they really connected with it and related to it. And I was interested in making a part of the actual research process and questions. Next slide. Lastly, so the way that this team came together, I feel very fortunate to be a part of this team, and the other folks who you see on the call today. Dr. Dan Martinez is someone who I've worked with for several years, primarily looking at death and disappearance along the border, along with our colleague, Robin Reinecke. Dan came in to really help conceptualize and write and analyze this survey, has an enormous wealth of experience in that area. Dr. Garcia brought the servingness model of his Nosotros team, which has this incredible recruitment and data gathering infrastructure to really help us reach people and gather this data. And then Dr. Adriana Maldonado came in as and took over as PI and was able to do a fabulous job directing the data gathering as well as contributing to the formalization and analysis. And together, our team received an HSI faculty seed grant in 2022. And this group has created what I think has been a really powerful vehicle for training and mentoring and engaging Mexican origin students. And I would love to pass the mic now on to Adriana to tell you all a lot more about that last piece.
Thank you, Rebecca. So as Rebecca mentioned, so Salud Sin Fronteras is a survey or is a project that aims to first mentor and train students with an interest in Mexican immigrant health, as well as to assess the extent to which pre-migration health and health experiences affect post-migration healthcare access among a sample of Mexican-born adults, and identify specific barriers to post-migration formal healthcare access among Mexican-born adults here in Southern Arizona. But before I go into the details of the research, because I know that we are researchers and we want to know about that, I first want to acknowledge the involvement of students in SSF. So over 4 semesters, we have had over 15 students who've been part of this project. In spring 2022, when we were awarded the HSI faculty seed grant, we started with a small group of students, like 4, as you can see on the screen, that range from undergraduate to PhD levels from multiple departments. The ones that are highlighted in blue are students who actually started as an undergrad and transitioned as either an MPH And like Stefania Ochoa, she started in fall 2022 with us, with a team of nosotros, as an MPH student, and she will be transitioning as a PhD student in clinical and translational sciences this upcoming fall. So as you can see, like without the involvement of students, the success of SSF wouldn't be possible, because they provided a lot of insight and actually were part of every single part of the project. So I'm really thankful for being part of this team and have had the opportunity to actually interact with students and provide some of my insight as first generation college students to them. So going back to SSF, Salud Sin Fronteras is a community-based survey that was conducted here in Southern Arizona, and this happened between April 2022 and February 2023. We conducted 300 surveys that from a sample of Mexican immigrants that came from Santa Cruz County, Cochise, Pima, and Maricopa. In order to be able to achieve this huge number of individuals, we conducted several outreach events in which our students were part of. So for example, here in the screen, you have pictures of the Nosotros team going out to the Tanque Verde Swap Meet, where we were tabling and talking to people about research, and Salud Sin Fronteras. We also went to Mexican Fiesta, where it's a baseball event that happens here in Tucson, and we were talking to individuals about their about Salud Sin Fronteras. We also attended the Mexican consulates in Tucson, Nogales, and Douglas, and that's why we were able to have a higher reach in our participants pool. So to give you a little bit more of context about Salud Sin Fronteras, so this is a survey that includes 8 modules, including migration experience, and includes questions such as HR migration or the reason to migrate, social capital, and includes things about density of the social network, how many members of the extended or immediate family have here in the US, health information in Mexico and the US, and that goes to Dr. Rebecca's Crocker interest in pre and post migration healthcare access, and as well as healthcare access, experiences about COVID-19, whether they have had a prior infection or as well as vaccination status, the use of alternative medicine practices, including plants, foods, reliance on curanderos, parteras, hueseros, and use of over-the-counter medication. As well as we ask questions on spirituality and health, how individuals use religious practices to deal with health disorders, religion as a way to promote good health. And of course, since it's a demographic and we wanted to characterize our sample, we included questions, demographic variables, including sex, age, marital status, employment status, as well as household income. So going into the results, and just to give you a quick overview of how the sample looked like. So most of the sample self-identify as women. They were around, like the mean age was 50 years. Most of the sample came from Sonora. About 70% reported being married, and about a third of the sample had an annual household or monthly household income between $2,000 and $3,000. About 40% reported not speaking English, and about 30% had an education of less than high school. But we also, as I mentioned earlier, we also asked questions about their migration experience. So 30% of the sample reported migrating to the US between the ages of 25 and 34 years, and had been in the US between less than 10 years. And if we think in terms of migration, most of this, like about a third of the sample were qualified as a recent immigrant to the United States. The reason to migrate, about a third of the sample mentioned that the reason to migrate in the United States was to reunite with family. And I think this is really interesting to point out, like in terms of my immigration status, about 20% of the sample reported being undocumented. And this is important to highlight because this is not something common that you would see in this type of research. So going with the results, and I in the interest of time, I'm just going to be going briefly over some of the results that we have. And the first thing that we wanted to explore is how does access to health insurance change pre to post migration? So looking at this graph, we can see that when we conducted a chi-square test, we found that health insurance decreased from pre to post migration. So when individuals were in Mexico, about 76% or 80% of the sample reporting having access to health insurance. However, when they came here and established themselves here in Southern Arizona, this percentage went down to 56%. The next question that we wanted to explore with this data is how does frequency of healthcare use change pre to post migration? And I know this is a busy slide, but what I want to point out is that if you look at the never category, the percentage of individuals who have never sought care almost double in size once individuals were here in Southern Arizona. So when individuals were in Mexico, this percentage of individuals who had never sought care was about 7%. But when they came here to the United States, it went up to 14%. Suggesting that there are some systemic barriers or some barriers that individuals are experiencing to access healthcare services. And in fact, when we explore the question about what are some of the barriers to accessing healthcare services, price, language, and lack of insurance were the top 3 barriers to care that individuals reported experiencing here in the United States. And the graph that you're seeing on the screen is just a comparison between Arizona and Mexico. But since going in line with today's topic, I want to go, I next want to highlight the students' experiences on being part of SSF. So here on the slide, we have Ana Gonzalez, who started as an undergraduate student here in Salud Sin Fronteras, and now she's an MPH student. And when I asked them to provide an insight or a testimonial of what their experience was being part of this project, I wanted to highlight that she told me that it was a really good opportunity because she felt that being part of this project, she gave a voice to her community, a community that is often ostracized. And similarly, Alejandra Hernandez, who is a current MPH student in public health, told us that she really loved recruiting out in the community and connecting with participants. It was rewarding working with SSF, and that she felt a better understanding of the barriers that many individuals face accessing healthcare. Martin Garcia, who started last summer with us, and he's a medical student, he felt related, a close connection with SSF because of his family background. And I think it's important to highlight that being part of this project gave him the opportunity to actually expand the theoretical experience that he had gained through his classes to something that was practical and he could actually put in practice through his medical training. Alejandra Cervantes, who is an incoming MPH student in public health, in health promotion sciences, wanted to highlight that being part of Salud Sin Fronteras helped her better understand the perspectives and necessities of others. And I want to point out that this was her first time being out in the community, and she has enjoyed and grown so much. Kaylin Bear, also an incoming MPH student, told us that by being part of SSF, she felt that as though by completing the surveys, the Mexican immigrant community were able to let these participants have their voices heard. So this speaks to how powerful and how empowered students felt by being part of SSF or Salud Sin Fronteras. Miguel Mesa, a current MPH student, said that Salud Sin Fronteras was an enriching experience both personally and professionally, that participating in the recruitment and data collection process helped him train in community engagement practices. Andrea Diaz, a current undergraduate student and soon to be a graduate, told that by collaborating with nosotros was an amazing experience. She was able to strengthen her communication skills, learn about her community, and understand why there was a gap in our healthcare system. Estefania Shoa, who is an incoming MPH student, also saw the value of being part of in Salud Sin Fronteras in her personal and professional life. And actually, as a result of being part of Salud Sin Fronteras, this project motivated her to pursue a PhD to further explore innovative ways to address health needs of Mexican and other underserved communities. So in terms of scientific outcomes or outputs, like this project gave students the opportunity to develop some summer programs, projects, I mean. As for example, Miguel Mesa was part of the STEP Hub, and he came up with this presentation where he explored experiences in accessing healthcare services using SSF data. Andrea Diaz was part of Frontera and Blazer, and she presented a poster presentation on the use of traditional medicine among people of Mexican origins in Southern Arizona. This was last summer. And Martin Garcia was part of the medical student research program here at the University of Arizona, and also had a summer presentation on the relationship between documentation status and healthcare use. I also want to point out that 2 of the current students are actually taking the lead on 2 manuscripts. Alejandra Hernandez is leading the manuscript looking at the association between social capital and healthcare use. And Stephanie Ochoa, using her medical background, is leading a manuscript looking at the use of over-the-counter medication use among Mexican immigrants in Southern Arizona using SSF data. So what are the plans for future research? Well, this is providing us some basics and really needed data. So what we're planning on using is expanding the Salud Sin Fronteras data to further explore the intersection of the social and built environment to identify social, environmental, and behavioral determinants of access to healthcare, and identify areas for intervention. At the end, we want to use Salud Sin Fronteras data to improve the well-being of the community. And also, we want to use this data to cultivate community-based participatory research on access to healthcare. So lastly, I want to thank all the students, my team, as well as our community partners, the Tanque Verde Suami, the Mexican consulates, and many other places where we actually went out and conducted this outreach and recruitment for the project. And here's my contact information and our social media. So if you're interested in this kind of research, please feel free to follow us on our social media. So yeah, I think this is time for questions.
Wonderful. Thank you all so much. For everybody who is joining us, you can throw your question in the Q&A box or in the chat, and Monique and I will actually ask you to unmute so that you can join the conversation. But I'll go ahead and kick it off with one question, and then we'll monitor the chat so we can pull in some additional questions. Well, I love the project, right? Because I have heard Adriana talk about it multiple times and have been in conversations with Dan and others as you all have described the multiple pieces that have informed the work. And I love that you all have highlighted students. And so I wonder, today is actually the deadline for the next round of funding for the HSIC grants. And I'm wondering if there are any tips or strategies that you all have to share with anybody who might be on the call or view this later who are considering submitting for some seed funding. So 3-part question. 1, around tips and strategies. 2, around involving students, because I think for you all, this is something that you've done exceptionally well, is involve a large team of students. So how do you do that, right? How do you do that when the seed funding is not a ton of money, but it is a way to support and mentor students in the process? And then 3, how does this set you up maybe to leverage some of the data for external funding in the future? So multiple part question.
I can go ahead. I'll start by maybe speaking to maybe tips about applying to the faculty seed grant. Well, first I'll say is, as researchers at, university like University of Arizona, R1, we all have great and interesting research project ideas, right? But what stands apart here is really centering student involvement. really trying to make good on that servingness aspect of our HSI status. And I think Adriana did an excellent job of highlighting the students' voices and thinking a little, helping us think through how not only are we going to help inform our understanding of the barriers to healthcare that Mexican immigrants are facing in Southern Arizona, but we are creating opportunities for students to connect not only with their own communities, with research that interests them, but also with important mentors and role models in people like Adriana and David and Rebecca, right? People who possibly share similar life experiences that they can connect with. So I think back to some of my own personal experiences, and I was fortunate enough to. I went to my undergraduate university, St. Cloud State University in Minnesota, and I remember being a senior in my undergraduate ethnic studies classes, and I had a Chicano studies professor who I think had a profound impact on my decision to go on to pursue a master's and then eventually a PhD. And working with him and another indigenous scholar by the name of Jean Lacourt, they actually had us put together our own interview guide and go to Canada to an Ojibwe language camp and ask people about their indigenous identities, and then go to Mexico, to a place in central Mexico. We know that Mexican folks have very, very strong indigenous ancestry. We see it not only in phenotypes, but we see it in food and customs, culture. But for various reasons, parts of northern Mexico, central Mexico have undergone this de-Indianization process, right? So the main objective here was to essentially compare and contrast how people in Canada and First Nations self-identify and kind of think through their indigenous identities compared to campesino folks in Mexico who are largely would identify maybe as mestizo but not indigenous, but live an indigenous lifestyle in a lot of ways. To kind of compare and contrast some of those experiences. And we only did, I think, maybe 15, 20 in-depth interviews, but yet that kind of sparked this interest in research for me. And so if it not for that opportunity to do that work, obviously we didn't go on to publish anything, but anyways, working closely with Steve, working closely with Jean, digging in, creating our own questions and kind of having that firsthand experience. That was my first exposure to doing this type of work. And then I think through then, the important role models that I've had, first, Steve Casanova is, my undergraduate career. And then here at the University of Arizona, I had an opportunity to work with Raquel Rubio Goldsmith, who some of you may know as the mother of ethnic studies in Southern Arizona. Raquel is an absolute powerhouse. She's a dear friend, mentor of mine. And one of the first projects that I got involved with when I came to here, University of Arizona, as a master's student in Mexican American Studies, was actually looking at medical investigator reports and autopsy reports of migrants who died while crossing the U.S.-Mexico border, right? So that was another project where not only am I learning how to do research, but I was being guided by somebody like Raquel. So all in all, I want you all, what I would encourage you all to do is think about that as you put together these HSI faculty seed grant proposals. Really think about the students, center the students, think about how this project is going to help make good on that servingness aspect of our HSI status. And so one way we did it, I believe, so the proposal we submitted was roughly $25,000. All of that money went to fund students, right? We didn't draw anything for summer salary or own, course release, nothing. It was all student. It was all to fund undergraduate students and graduate students. And I think that's one way, really make it get students involved. And, if it weren't for Adriana and David, we wouldn't have been able to pull this off. So I'm very grateful to nosotros. I'm really grateful to David's team to be able to help us accomplish this. So with that, I'll go ahead and pass. Thank you.
Yeah, I'll add to that. I think that's well stated, Dan. Thank you for sharing your journey. Because I think it's very for all of us, right? I think, we are underrepresented as far as PhDs go. The rates are terrible, to be honest. And I think that's something that nosotros, all of us, has committed over the past now 8-9 years to, mentoring students. And I always say my family tree is over 100 students, trained through nosotros. I have 7 assistant professors, including a new one starting July 1 here on this as well, in addition to Dr. Crocker as part of the team. So I also want to highlight not only that commitment, but the commitment of the team, because again, it's interdisciplinary. I think that aspect, like to kind of take, what Rebecca's dissertation was, like Dan's expertise, meld it with mine, in addition to like Ariana's, it made like the most beautiful creation that we could potentially do with the different perspectives. And like, it is trying at times, we are even working through our disciplines, like, what is this in your field? What is this in this? What are the expectations? But I think that's like the beauty about this aspect, because in reality, if we say there's a divide between health sciences or the college or let's say south of Speedway, it creates these conversations, right? Like, we need to bring this. There should be bridges across to actually help each other, but ultimately help our students, because there is power in numbers. So I'll just add to that, like, that's the first and second piece, I think, just people to think through, is that sometimes it's okay to be, you have to be comfortable with being uncomfortable. And I think in some cases, we haven't always been comfortable together as a team, but we're able to talk through that and work through it as a team to kind of come to a resolution that is best for our servingness aspect, in addition to our students. And that's ultimately what we care about. I'll let Dr. Maldonado or Dr. Crocker talk about extramural funding.
I can go next. So actually, we are planning on leverage this data, because this is like the way it was presented to me, and I'm so grateful for this opportunity. This is pilot data. So I'm actually planning on leveraging Salud Sin Fronteras data to go after a K. So that's how we can use this to actually expand. And at the end is for the well-being of the community, because the community is at the center of this research. So that's something that also was clear in everyone's of all the students, like testimonials of being part of the student. It was like community center. They enjoy being part of the team because it was their community. So I'm taking the same perspective and using this project, which has taught me so much, to actually go after NIH funding, like K, which is the next logic thing for me in my career right now.
I don't think I need to add anything more. Those have been great answers. I don't know if there are any other questions out there.
I would just maybe kind of summarize everything in terms of, like, because the HSI faculty seed grant deadline is coming up for those of you that are interested in applying. Again, prioritize center students, prioritize that servingness aspect of the HSI mission. Make sure that your budget is going towards supporting students, right? I think that's really important. Also, I think making sure that you have not only a interdisciplinary team, but a multidisciplinary or transdisciplinary team, right? So had Rebecca and I teamed up to do something like that, that'd be considered interdisciplinary. But because we are crossing Speedway, we're going and working with folks in public health. That now takes on a whole nother dimension. It becomes, transdisciplinary or multidisciplinary in a lot of ways. So I think that speaks to what David was mentioning. And then so I can't remember the last thing I was thinking, but those were the three I would probably prioritize. Making sure that your funding is going to support students, center students, emphasize interdisciplinary approach. Oh, and then the other thing would be if you have a team member, make sure try to prioritize a junior faculty member as maybe the PI. I think that could be also something that would be important as you put your packet together.
I'm just going to send this webinar out from now on for as the info session, because you all hit many of the priorities. So thank you. I appreciate such a thoughtful response from all of you. We have time for other questions. I know I asked a big one. So if there are other folks that want to jump in on the chat or the Q&A box, we are happy to take additional questions.
Sorry, I think I just hit the record button. I don't need to record. Sorry.
It's already recording. You're fine.
One thing I'll say is, we are definitely seeing this as a pilot program, pilot project to go after additional external, funding. But I'm also really excited about this project. I mean, here we have, a survey of 300 adult immigrants in Southern Arizona, 20% of our samples undocumented. And we're already starting to see patterns emerge out of the data where documentation status is playing a notable role in shaping people's access to health and healthcare. I think that's phenomenal. I mean, I haven't seen a lot of these, I haven't seen many data sets that include documentation status, and where people were pretty comfortable. I think that speaks to, the training that the students received and how comfortable they are with nosotros, that we had at least, 20% of the samples say, yes, I'm undocumented, and we're seeing it map onto, several outcomes. So I think that is particularly important. So, it's just the sky's the limit with this project. I'm really excited. There's so much there. I think we're going to be able to publish several manuscripts or articles based off of it, and also leverage it as pilot data to go after external funding.
Thank you. Adriana, you mentioned a K award. For those who are not familiar with NIH funding, what is a K award?
So it's a training mechanism through the NIH, through NIH. So, and it's gonna serve as a stepping stone for me to go after bigger grants. So it's a mentor training.
Thank you.
I'll add something in terms of the cross-disciplinary and interdisciplinary collaboration that Dan and David have both highlighted. As an anthropologist, as I mentioned, I always was really interested in producing data that would be helpful. And I think, we can get caught in these silos. Obviously, in the university and in anthropology, we often feel that we're talking to ourselves. And I think we talk about very interesting things to ourselves, but that doesn't necessarily mean that it has the impact that we want it to have. So one of the most interesting things for me being a part of this project was seeing something that started very conceptually take the form of a solid, really validated survey instrument that we could use to get the kind of data that could speak to public health. And it really spurred an interest in me in having that be part of what I do in my career, is working to make survey instruments more valuable. Because as an anthropologist, as someone coming with a qualitative background, a lot of times I look at the questions and wonder, would I be able to answer that question in a way that feels representative of how I really feel about what they're trying to get at? And so that has been something that's really interesting. It was a really engaging process between the four of us, in addition to a couple of the students who were involved early on, including also just with translating the document. Okay, like we finally got it together in English. Now, how are we really going to translate that in a way that it actually makes sense in Spanish, and in Spanish that's used regionally in Mexican origin populations in Southern Arizona? And there was just a lot of work around making sure that this instrument was capturing valuable data, so that even though we have 300 people, which isn't the most enormous sample, as Dan was saying, we feel like we have really solid data that we can do a lot with, because we spent a lot of time making sure that the instrument was as true to the questions that we were asking and as accessible as possible to the people who were participating, and by extension, that it was something that the students could enjoy carrying out with people and conducting those surveys that felt a little bit like an interview. It was a very long survey. It was about 45 minutes, right, Adriana, on average, so that they could really enjoy and feel that they were offering a nice conversation that the participants were getting something out of as well. And so I just wanted to note that that was a piece that we really put a lot of time into, that has had a lasting impact for me and my other research collaborations as well. And that makes us feel particularly good about the student involvement and the data that we ended up getting.
Thank you. Thank you both for sharing a little bit more. I mentioned in the introduction that we end every webinar, and actually we have so many of our conversations with the question of how do we continue to institutionalize this work? And there are a lot of efforts happening. I mean, there are a lot of programs going on across the institution. Now we have, of course, HSI Initiatives is under the Office of the President, led by Dr. Marla Franco. And there's a number of initiatives centered within HSI Initiatives, as well as partnerships across the campus. But how and where do we continue to push? What would you all like to see? What advice and recommendations would you offer? Not just for the U of A, but for our colleagues as well who are on from other HSIs.
That's a great question. I think, recruiting and retaining, I'll say in the specific context of, HSI institutions, obviously recruiting and retaining talented Latino, Latina, Latinx faculty. I think that's huge. That's really important. Also, I think, just projects like this, if we think about it, we can kind of almost look at it as a multiplier effect, right? So here we have this $25,000 seed grant, the work that Adriana put in, Edgar put in, David put in, Rebecca put in, into putting this team together, getting the students engaged, getting them to, to be enthusiastic about a research project that they identify with, serving as an important mentor for these individual students. Now we have several students who are going on to graduate school, going on to medical school, going on to do an MPH. And I'm going to see, I think we're going to see a multiplier effect over time. Those students are going to finish, they're going to go on, they're going to have their own students, and we're going to see this continue to grow and grow. So I think it's actually quite powerful, right? I think, I'll just say, I was a graduate student here at the University of Arizona. I was a graduate student before we had HSI status. And I have seen a tremendous difference from the time I was a graduate student here in the early 2000s to through the time that we got our HSI status and Dr. Franco came on board. I mean, I think we are a great example of making good on that service aspect of our HSI status. There are a lot of HSIs out there that are just HSI in name. But, what I really appreciate about the team here is that they're walking the walk, right? Not just talking the talk. And I really appreciate it. And I see a marked difference from before, when I was a graduate student, when we did not have our HSI designation, to today. It's a world of difference. And I'm so grateful, and I'm so fortunate to be part of the U of A community. So thank you.
Yeah, and I'll just add to that, again, I think it always comes down to the students. The reason why it's successful and you see the matriculation is the fact that we protected them. They didn't have to work 3 jobs. Like, they were able to focus on this aspect, work with us, be ingrained in it, get the mentorship that allow them to make decisions about going on to their MPH or PhD. And otherwise, a lot of students are worried about how they're going to pay for school, like they're working 2 jobs plus trying to volunteer for labs and do their schoolwork. Like, we have to invest early. Like, all our efforts generally with consultants has always started at the undergrad level. Like Edgar Villavicencio, who Dan just mentioned, he's been with me for 7 years. He was the first class I taught as an undergrad, and now he is my research coordinator leading these efforts, but he has been trained, well published. He's a long-term investment. And so I think just being very intentional and providing that support and allowing them to grow. And I think it's part of our training programs, but like literally pushing that agenda more so they are not stressed about all the other aspects. And also acknowledging that, like, I think we're all here pretty much first generation. We don't know what we don't know. Like, we muddle through it. And in fact, like, there's a lot of students we've had in tears like approach us because it's like that aspect. And we learned after 20 plus years almost for some of us, they deserve to know in years 1 and 2. And I think we can do better in that regard. So yeah, that's what I got.
Yeah,
I would echo that. Oh, yeah, I would echo both Dan and David's points. Actually, as a first generation student, immigrant, even figuring out the system, like, how do you know what to do next? I wouldn't be here if it wouldn't be because of mentors like David, Dan, or people that were help me navigate the system. So the way I see this now that I'm here, I'm paying it forward. Like, the mentoring of the students that I listed in the presentation, it's my way to thank my mentors. Like, I know all the work that they put into mentoring me and showing me the path to go. Now it's my time to pay it forward and helping students not go through some of those barriers that I had to go through. So just realizing that there are things, as you said, David, there are things that we don't know because we don't, it's the first time that we're experiencing this. So share that information with students. And also, as you said, Dan, diversity matters. If you have students who identify with you, they're going to be more likely to stick with you. Honestly, they're going to be more open, share their experiences. And the mentoring is not just academically, it's about life too. That's the other thing, that we have to be open. It's not just like academic mentoring. You're gonna have to deal with some of the other stuff, like life experiences, and you're also gonna go through that with students.
Yeah, I kind of just contribute, building off of what both Adriana and David said, I think it's not just about, okay, we have students who are going through this, but rather, people, students who are working with, on a topic that they enjoy, or, brown faculty working with brown students. It's much deeper than that, right? So when we think about, that's important. That's extremely important to be able to see yourself in others and vice versa. But when we think about what this is all about, it's all about, building up various stores of capital, whether it's human capital or social capital or cultural capital, just understanding the system, like Adriana was saying, like David was saying, figuring out, helping just to navigate the system, right? And, these students now are forever connected to David and Adriana, and David and Adriana are important nodes in their network moving forward. And they're going to be able to leverage these networks for support moving forward, right? So that's really kind of where, as a sociologist, this is also kind of, gets me pretty excited about this, because that's, we in sociology, that's what we deal in. And, we deal in social capital is, quite a bit, a primary focus of what we do. And so it's that's kind of part of that multiplier effect, right? And kind of going back to what David was saying, is trying to demystify the experience, in higher ed, I think is a big part of it.
Well, thank you all for your words of wisdom, for your passion. I was sharing recently, I was doing a session on culturally responsive pedagogies to a group of faculty. And I shared with them that as a Mexican-American student, I didn't have a Latino faculty member until my graduate program, until my PhD program, actually. And I grew up in a Mexican-American community. And now that I think about it, right, it just blows my mind that it took so long to have somebody in front of me who represented possibilities and who represented my home and my community. And then who introduced me to scholarship that was so deeply meaningful, the way that you all are doing with the students, deeply meaningful in cultural ways and family ways. And then who, of course, created opportunities because my social networks were greatly expanded. And so, you all are providing access to so many students, in addition to doing really important scholarship that is benefiting multiple communities and multiple issues. So thank you all so much for this, for your time, for your dedication, for the project. This has been a really wonderful session to learn with you and from you. So thank you all. Thank you everybody for joining. The webinar series will be back in the fall, but this is our last one for the academic year, and we'll make sure the recording is up on our website and make that accessible to everyone. Thanks so much.